The COVID-19 pandemic is far from over. New variants of the virus are emerging, posing a significant threat to global health. These variants, with their mutations and enhanced transmissibility, have the potential to undermine the progress we've made. The World Health Organization estimates that hundreds of Omicron subvariants are currently circulating globally. This serves as a stark reminder that we must remain vigilant and proactive. The emergence of these new variants underscores the unpredictable nature of this virus. It highlights the critical need for continued genomic surveillance, vaccine development, and adherence to public health measures. The Philippines, like many countries, is grappling with the emergence of these new variants. The country has made significant strides in its vaccination efforts, but the battle is far from won. We must remain informed, vigilant, and proactive in our efforts to protect ourselves and our communities. Viruses, like living organisms, constantly evolve. They change over time through mutations in their genetic code. These mutations can lead to the emergence of new variants, which are essentially versions of the virus with distinct genetic characteristics. Some mutations may have little to no effect on the virus's behavior, while others can alter its transmissibility, severity, or ability to evade the immune system. The more the virus spreads, the more opportunities it has to mutate. This is why widespread vaccination is crucial. Vaccines help to reduce transmission, which in turn limits the virus's chances of mutating into new, potentially more dangerous variants. By understanding the genetic changes in the virus, scientists can better assess its potential impact and develop effective countermeasures. The science of viral evolution is complex, but understanding the basics is crucial. New COVID-19 variants pose a significant threat to global health systems. Their increased transmissibility could lead to a surge in cases, potentially overwhelming healthcare systems still recovering from previous waves. This surge could lead to shortages of beds, medical supplies, and healthcare workers, impacting the quality of care and leading to increased mortality rates. Beyond healthcare, the emergence of new variants could have severe economic consequences. Lockdowns and restrictions, if implemented to curb the spread, can disrupt businesses, impact livelihoods, and slow down economic recovery. The uncertainty surrounding new variants can also lead to decreased consumer confidence and investment, further hindering economic growth. A surge in cases in one part of the world can quickly spread to others, as travel restrictions may not be sufficient to contain highly transmissible variants. The global impact of new COVID-19 variants extends beyond immediate health concerns. Addressing this threat requires a coordinated global effort, encompassing public health measures, vaccination campaigns, and continued research and development. The Philippines, with its dense population and developing healthcare system, is particularly vulnerable to the emergence of new COVID-19 variants. The country has experienced several waves of infections, and the healthcare system has been strained at times. New, more transmissible variants could potentially lead to a surge in cases, overwhelming hospitals and healthcare facilities. The economic impact of new variants could be particularly severe in the Philippines. Lockdowns and restrictions, while necessary to control the spread, can disrupt livelihoods, especially in the informal sector, which employs a significant portion of the population. Despite the challenges, the Philippines has made progress in its fight against COVID-19. The government has implemented vaccination programs and public health measures to curb the spread of the virus. The emergence of new variants requires a sustained and adaptable approach, focusing on strengthening healthcare infrastructure, expanding vaccination coverage, and promoting public awareness and adherence to preventive measures. Prevention is our strongest defense. While the emergence of new variants is a cause for concern, it's important to remember that we are not starting from scratch. We have learned valuable lessons from the pandemic and have effective tools at our disposal to combat the spread of the virus, including new variants. One of the most effective ways to prevent the spread of COVID-19, including new variants, is through vaccination. Vaccines are incredibly effective at preventing severe illness, hospitalization, and death from COVID-19. While the effectiveness of some vaccines may be slightly reduced against some new variants, they still offer significant protection. Getting vaccinated and boosted when eligible is crucial in protecting yourself and others. In addition to vaccination, practicing everyday preventive measures remains crucial. This includes wearing a mask in public indoor settings, frequent hand washing, and maintaining physical distancing whenever possible. Early detection allows for prompt isolation and contact tracing, breaking the chain of transmission and preventing further spread. Vaccines, our best shot at immunity. Vaccines remain our best shot at ending the COVID-19 pandemic, even in the face of new variants. They are incredibly effective at preventing severe illness, hospitalization, and death from COVID-19. While the effectiveness of some vaccines may be slightly reduced against some new variants, they still offer significant protection, especially against severe outcomes. Vaccines work by teaching our immune system to recognize and fight off the virus. They introduce a harmless piece of the virus or a blueprint of its genetic material into our bodies, triggering an immune response. This response prepares our bodies to fight off the actual virus if we are exposed, preventing or reducing the severity of illness. It's important to stay up to date with COVID-19 vaccinations, including booster doses when eligible. Staying up to date with vaccinations ensures optimal protection against COVID-19, including new variants. By getting vaccinated and encouraging others to do the same, we can protect ourselves, our communities, and contribute to ending this global pandemic. Public health measures, such as mask wearing, physical distancing, and contact tracing, have played a crucial role in mitigating the spread of COVID-19. These measures remain essential, even as vaccination rates increase and new treatments become available. They provide an additional layer of protection, especially in settings where vaccination coverage is low or the risk of transmission is high. Mask wearing, particularly in indoor public settings, helps reduce the spread of respiratory droplets which can carry the virus. Wearing a well-fitted mask covering both the nose and mouth is essential for maximum effectiveness. Physical distancing, or maintaining a safe distance from others, also helps reduce the risk of transmission. Contact tracing is another essential public health measure that involves identifying and notifying individuals who may have been exposed to someone infected with the virus. The fight against COVID-19, including new variants, requires a coordinated global effort. No single country can tackle this pandemic alone. International collaboration is crucial for sharing information, resources, and expertise to effectively monitor, track, and respond to the evolving threat of new variants. Sharing genomic surveillance data is paramount. When a new variant is detected in one part of the world, it's crucial to share this information quickly and transparently with the global community. Equitable access to vaccines, tests, and treatments is also essential. By working together, sharing resources, and supporting each other, we can overcome this pandemic and build a healthier and safer world for everyone. As we move forward, it's crucial to remain vigilant and prepared for the emergence of new COVID-19 variants. The virus will continue to evolve, and new variants may emerge with different characteristics, such as increased transmissibility, immune evasion, or severity. We must be prepared to adapt our strategies and responses accordingly. Continued investment in research and development is crucial. We need to enhance our understanding of the virus, its evolution, and its interaction with the human immune system. Strengthening public health infrastructure is equally important. By prioritizing public health, investing in research and innovation, and strengthening global cooperation, we can navigate the challenges ahead and build a more resilient and healthier future. The emergence of new COVID-19 variants underscores the importance of individual and collective action in protecting ourselves, our loved ones, and our communities. We all have a role to play in ending this pandemic. First and foremost, get vaccinated and boosted when eligible. Vaccination remains our best defense against COVID-19, including new variants. Continue practicing everyday preventive measures, such as wearing a mask in public indoor settings, washing your hands frequently, and maintaining physical distancing. Stay informed about the latest developments and recommendations from trusted sources, such as the World Health Organization, your local health authorities, and healthcare providers. Accurate and up-to-date information can help you make informed decisions about your health and protect yourself and others. By working together, supporting each other, and following the science, we can overcome this global health crisis and build a healthier and more resilient future for all.